I'm an engineer, so I'm very drawn to complex problem solving, basically. So before I set up MEG, I ran a software services company for around 10 years, building apps for different industries. And I got a lot of exposure to different problems, and I discovered that I really liked working with people in healthcare. There is no more complex environment than the healthcare environment. So building apps and systems for healthcare workers was something I've always really loved doing. Yeah, those first few years are really busy. I would have spent a lot of time travelling to hospitals around Ireland, getting early morning flights over to the UK. I built a really good relationship with lots of hospitals in the NHS. I would give them early versions of our app. They would give me feedback on how to improve it. So there was a lot of back and forward and product iteration and really fast development. So it was a really exciting time, and I had a really good team around me that were very focused on, on solving problems for frontline workers. So yeah, it was just a really exciting time.
I guess what stood out for me in the early days, or maybe even before I joined, was the real clear mission that Carol and the early MEG team had, which was to help improve the lives of frontline healthcare workers. And then I guess I joined the team, and we, in those early days, I saw how this relatively simple technology was really helping frontline workers, making their jobs easier. And then of course your interactions with those people, those doctors, those nurses, those pharmacists, you get to really see just what fabulous people they are, how they dedicate their lives to such a great cause. And yeah, you probably don't see that as much in other industries, so it was just like a great place to work.
My background is I started software development early, from 12, 14 years old. I never thought I'd be a professional software engineer, but I moved to Ireland and I went to college and I got an internship in Carol's company. So we worked together for a bit before MEG was actually founded.
Yeah, I joined MEG in 2016, and what stood out for me was what MEG is doing at the core. That it's bringing technology to serve healthcare workers, to make their life easier. And that was pretty much in line with what I was planning to do in my life. So I joined as an intern on the scholarship called Fast Track to IT. And after, printing out Hello World and Python, I was thinking, is that easy to become like a software developer? And this is how I find MEG among like two other companies that offer me internship. And yeah, we took it from here, and it was a great journey so far. And it was really aligning what I was interested in, like sustainability, with how technology can solve problems, the real life problems. Yeah.
About 3 years into the journey was a really important time for us. We just built we had MVPs, we had customers, but we were still just generally building tools for people. So we got accepted on an accelerator program here in Dublin, and our management team also started taking shape. So that was a really important process, having the time to sit down, do interviews with potential customers. We refined what we did and worked out that what we're doing is actually improving quality and patient safety. So we flipped our whole focus, redeveloped our website, focused our product around quality and patient safety specifically, and that allowed us to get a product market fit, and also realize that what we're doing has a global impact. Every healthcare organization around the world has a requirement for quality and safety. So that was just a really important moment for us in discovering exactly what our path was. Yeah, some other moments that were really important. In 2000, obviously when COVID hit, there was a complete change in how healthcare organisations operated. From having to get early morning flights and travel to the UK all the time, all of a sudden everybody was able to use Teams. We were able to do a lot more meetings. A lot of healthcare started to become much more digitally focused. So that created a great opportunity for us to work with more international clients, and it's just really brought a really big boost for products like ours.
So key milestones, I guess in the early days, we got a small, loan from Bank of Ireland. We joined the NDRC Accelerator program, and then that prepared us to raise some funding, and all of this was to grow the company. So that was probably, they were small milestones that allowed us, really bring about the vision that Carol had from day one was to go global. So it allowed us to hire, people who spoke Spanish, and people who spoke Arabic, people who spoke Portuguese. Some of those people were based outside of Ireland. And then we got our first customer, in Argentina. We got our first customer in Dubai, and taking it from there. So I would say they were the sort of key milestones, really just bringing in those people that helped us on the journey.
So the first one I'd say was when we moved out of the shared office into our own office space. It was a big milestone for the company. But technically, the big milestones in our product was switching our stack from a single server to Kubernetes, and that prepared a product for a global scale.
For me personally, the milestones were always wrapped around our customers. So the first big customers in Ireland, I'm thinking about sports clinic, surgery sports clinic, part of UPMC, as a big one. I'm also thinking about GSDT in UK or Lothian with like very complex solution that we managed to bring together with a team, the local team of the hospital. And that always created very tight relationship with MEG staff members and project managers from the hospital. So this relationship that we built over time, we solve their main problems and we actually grow on the way along with the customers. So I really like the approach that we actually bring solutions for their problems. So these are the key milestones. The other thing I'm thinking of is actually adding new modules to MEG. So starting from audits, we added loads of things like incidents management, risk registers, MEG docs, and all the new functionalities that we have. All of them are milestones to what we do.
Yeah, the last 10 years has been amazing. We're working with some brilliant healthcare organizations all over the world now. We have one customer in Latin America who is reporting a 10% reduction in hospitalizations after bringing our product in, which is amazing. So my ambition would be to have that at scale across the world, that we work with healthcare organizations all over the world and be able to replicate that impact everywhere would be an amazing result. My ultimate goal is to build a great business and also hire great people, people who are passionate about building healthcare quality management systems. I want to create an environment that everybody really likes to work in, so that if everyone's thriving, we'll do amazing things. And I just really want us to keep our focus on what our original goal was, which was to improve life for frontline healthcare workers and make things safer for patients. If we can stick to that ethos and that goal and hire the right people, I think the next 10 years are going to be amazing.
Growing the team is something I really look forward to. So far we've, on our management team at the moment, quite a few of the team have joined the company, in junior roles and worked their way up, and just giving that opportunity to more people in the future to be able to develop themselves and to become managers and senior managers. That's something I'm looking forward to. Maybe looking forward to hitting the 50th country where MEG is used in. We're a bit away from that. I think we're about 30 at the moment, but like hitting maybe 50 countries or maybe 100 one day.
Yeah, having MEG in different countries, different languages, having big customers like Davita and all that. I think this is where I see the growth and I see the future of MEG. And I'm excited to be part of it, yeah.
The AI is a big game changer. There's lots of potential in it that's yet to fully realized, and it'd be interesting to see potential in improving our product quality and also automating tedious work.
There's a quote: if you want to go fast, you have to go alone, and if you want to go far, you have to go as a team. And I think this is where MEG Future lives. We have to go far as a team.